Community Services Director and on the board for Coddington Connects. Good morning.
Good morning. Thanks for having me.
Yeah, thank you for joining us. Another new guest in our studios. We appreciate you coming in.
Yeah, it's great to be here.
Yeah, you bet. So maybe let's talk a little bit about your initial Community Services Director. I mean, I've been kind of covering that for last 4 years. Mm-hmm. You've done a lot of work to even change the title and all sorts of stuff. Tell us about what you do.
Yeah, we're pretty proud of our office. We've come a long way, and we function differently than a lot of other counties in South Dakota. So it's really great to see what our county commissioners have supported and the level of support that they have, recognizing that if we can catch people upstream, we can save money downstream for them. So we have a lot of different programs in our office. Our primary goal, the primary goal of county offices, formerly the welfare office, I just didn't really care for that name. I didn't feel like it was really accurately portraying what we do. Mm-hmm. So the primary role of county offices that serve our function, though, is to manage county indigent funds. And by state statute, all counties are designated to have indigent funds that are meant to help with things like potentially medical costs if people can't afford insurance, funeral assistance, or we also have economic assistance. However, also in state statute, anybody that we help, we have to put a lien on them. So if we were able to help somebody with rent, which they would have to meet a bunch of guidelines, mm-hmm. but if we were able to help them, we then have to put a lien on them, which means they have to pay it back. And again, that's state statute, not something we're choosing, just the way the state runs. So with that, we really have worked hard to avoid having to help people through county funds. We want to help them any other way we can before we help with county funds. Mm-hmm. So that's the indigent funds piece. We also help people, we see more and more funeral, people that don't have any resources for funeral assistance and that kind of thing. And so we work with the funeral homes if people need indigent assistance. Again, they have to qualify, and families are first responsible, and there's a whole bunch of different requirements in there, but if all of the things, if they meet all of the criteria, we would help cover that. Yeah.
And you do a lot of work with that mm-hmm. actually. So people reach out to you and like the funeral issues, if you will, like you've actually had to help people out with that situation in the past. So you just have, what is the best way? If they are in a situation, they just reach out to the office or go online, or what do you think is best?
Yeah, there's a couple different ones. If it's a funeral assistance, we always go to the funeral. We have the funeral home refer people to us. So if there's a funeral situation, we talk to the funeral, and the funeral home, they're gonna work with you first, and if needed, they'll refer you to us. And so that's how we get those referrals. But otherwise, if it's something like rent or other assistance, call our office. One of the other things that we've really worked hard to do so that we can avoid those things is we now have a community health worker program that started about 4 years ago. Time flies. It started through a grant that we have. It's called the Impact Program. And our community health workers are fantastic at helping connect people with resources that they may not even know are out there. So energy assistance is a great tool. We are able to get a lot of people the help that they need through energy assistance. And again, our community health workers are experts on that. We have 2 of them in our office. And anytime people come in, I always send them to them because they're the ones that specialize in those types of things. They do a fantastic job.
Awesome. And I think the comfort level too, I don't know if that's something people are aware of, but I've done, is it a poverty simulation mm-hmm. Before, and that was very eye-opening, mm-hmm. but also I have to admit familiar too, mm-hmm. With some of how I grew up, and even mm-hmm. in my early young adult life of moving out right away. Mm-hmm. And it was interesting, going through that, almost like, okay, I won't pay this to pay this, or shifting mm-hmm. those funds around in your home or all that. So you do have different tools available for mm-hmm. people to help them. Also, it's kind of for those that think you're not just bailing people out, it's helping them as well, right?
100%. Our goal is to help people get on their feet. Mm-hmm. It's not to continue using the system, but to really help people get on their feet. One of the things that I'm really excited about, our community health workers, and actually around 25 different people across our community have been trained in a model called Transition to Success. And Transition to Success is a nationwide model. It's proven effective, but it looks at poverty as a medical condition, and it tries to shift it from a personal failure. I think too often in our world, we think people that are poor are just poor because they made bad decisions, when the reality is most people that are poor are born into that situation and have never had the support or opportunities that they need to be able to move out of poverty. And so Transition to Success is one of the models used by our impact program, our case managers, to really see what supports we can give people to help them move out of poverty, to reach the goals that they have in life, and to live the life that we all want, we all dream of, and just to help all people kind of level the field and look at from a diagnostic category of what supports do people need to be able to move out of poverty. So that's one of the really cool things that our community health workers have started doing.
Wow. It sounds like there's a lot of like psychology in there, more understanding of why I've seen that, not what has happened to people, or not what did you do, but what
happened to you.
Yeah, there you go, I had it backwards.
Yeah, no, that's such a great thing. And like when we're looking at trauma and all of that in the world, and you're right, it can go really deep, but it really is shifting that narrative from what's wrong with you to what happened to you is an important thing. And we try to meet everybody there.
So you also are involved with an organization, Coddington Connects, that I really like, because one thing that can be difficult is there's so many different organizations that help, and even one person can have multiple concerns, but you've worked really hard on kind of getting some of these major groups together. Could you tell us a little bit about this Coddington Connects?
Yeah, so a lot of people are super confused, and they think our office is Coddington Connects, which is strange because Coddington Connects doesn't actually have an office. Coddington County Community Services oversees Coddington Connects, so it kind of is our office just by default because we oversee it. But it came out of this really great initiative. When I started, which was in 2021, I started, and the commissioners had asked to develop a system of care. They weren't necessarily sure what that looked like, but that fit in my wheelhouse really well. And so I pulled all the social service providers together. We all came together and started having these really great discussions. And one of the things we wanted to do was let our community know all of the resources that are available, and that we're working together, and that we're united to help people serve each other. And so through that process, and through a grant that we received from the State Department of Health, and some other service, we worked with a marketing company, we developed Coddington Connects. And so Coddington Connects is really intended to be that overarching umbrella that brings all of our social service providers together and makes it easier for people to access resources. So currently it's a website. It has all of the resources in Watertown on there. We now have about 45 different partners that are part of Coddington Connects. We have a Facebook page. A lot of different things that we're doing with that. It's a great resource for the community. And now it's kind of evolving to the next level because we've just finished the paperwork to become a 501c3. We have a board, and so it's kind of taking on its own legs. I'm really excited for it to be its own entity. We have some exciting things coming up with it. I think in the next 6 months, people are going to hear a lot more about it, and I'm excited to see what happens with it.
Wow. And so you, I think you've also developed, what is Angie Collignon? Is she, like a position was kind of developed out of that too? What is she involved with there? Yeah,
so Angie's fantastic. We were able to receive, again, through partnerships that we've developed in the community, we received it was called a Reaching Rural grant. And it was a grant targeted to rural communities to develop programs for people in the justice system who have substance use disorder. So through that Reaching Rural process, which there were 6 core team members here in Watertown that kind of developed that, we then applied for and received a $1 million grant through the Department of Justice. And through that grant, we were able to create Angie's position. She's doing a fantastic job developing programming that supports people in the justice system who have substance use disorder. There's a lot of different pieces, and Angie's kind of that coordinator pulling it all together. But really, she's developing a diversion program so that we can keep people out of the legal system that don't need to be in the legal system. We know that once people get in, it can be really hard to get out. So she's working with the state's attorney and the judges to keep people out that don't need to be in, with some diversion programming. I want to be clear, diversion doesn't mean no consequences. And actually, I think a lot of times diversion actually has more consequences because it requires that they do some classes, some community services, there's accountability. They're not getting off for free, they're actually having more accountability than just paying. And they sometimes still have a fine too. So there's different pieces in there. So that diversion program is up and going now. They're on the verge of starting a pre-trial program, and that's a program for people that are charged, but maybe can do some work before they actually get sentenced and go through. And so it's a support service for people before they're in front of the judge and doing things, so that they can have some accountability and maybe make some changes to their life before they're, again, long-term in the legal system. Again, another way to try to prevent long-term legal system involvement, reduce involvement with that. We're looking at also, and we have some other supports in place through that grant. We have a great partnership with Brothers and Sisters Behind Bars, and they provide support services for people coming out of the legal system, coming out of prison, coming out of jail. So we have a lot of supports with them too.
Wow. So you really seem to deal with like complex situations, of course, but you don't, like, I want to be very careful to not stereotypicalize any individual, because anyone can be in any of these situations quite easily. But it seems like you're dealing with people that maybe are one or two decisions away from being in a situation or a paycheck or two, or you get injured, or I mean, there's just so many things if you were incarcerated. So you're working on getting these people educated, but also, in this mindset of getting back and being productive in society too, which hopefully alleviates cost in the future. So it's like this long-term goal in the end, but you're also helping people. So it's very complex. It
is, and that's absolutely our goal. Our goal is to help everybody feel like they're productive members of our community. It not only saves our community money by avoiding situations where people are homeless or in really crisis situations, and hopefully we can support and avoid that, but it also gives people meaning in life, and I just believe everybody has value. Every life has value, and so when we can help people reach their full potential and feel good about their role in our community, that's what we want to do.
And so when you touch on that, do you deal with with those that are need emergency housing? I think, is that the right term for that? Watertown Cares, I think, is a group that kind of helps with that too. Does Coddington Connect work with them? Yeah, so, and I happen to be on that board because that was one of our first projects that we did. Kind of when we pulled everybody together, we identified the need for emergency housing. We were able to get another grant through that, and now Watertown Cares exists and is doing a fabulous job helping people get on their feet and move forward. And so our office, the Codington County Community Services, works really closely with Watertown Cares and the staff over there, supporting them and doing what they can. We have referrals back and forth all the time. And Watertown Cares is a member of Coddington Connects, and so we all work together, and we have a lot of partnerships there. So maybe you could tell me too, I think, is this a newer program with the Restart program? And that, does that deal with Angie? Yes, as well? So Angie oversees the Restart program. So that is kind of what her program is the Restart. So if people have been seeing, there's been a lot of social media posts and different stories about local people. And so that's part of our campaign with the Restart. So yeah, again, Angie oversees that piece of it. Restart was what our Reaching Rural team named the effort that Angie's leading. Okay, very cool. And so these are people then, so they can actually see that story, after they've come through that, and kind of see the hope that's, the end, right? The happy ending, if you will, so that it's possible. Yeah. Well, is there anything else that we missed here? Because we could probably talk a long time for what we have, but I want to make sure we hit, the real important things. This is kind of important time of year too. I know for some folks it's tough for some monetarily and mentally as well, but
yeah, no, I think that hits it. I mean, like you said, this time of year is tough. One thing for people to know, a lot of supportive programming that has been out there is expired. We had a COVID fund that just ended in September that helped people pay rent. That is gone. And so people that kind of have those one-time situations where life is really tough, or maybe they miss a paycheck for whatever reason, we don't have some of those safety nets in place anymore. So we're working really hard to help people try to find what they can to get help. There's just not a lot out there right now. So I think for our community, I've always said Watertown helps Watertown. And when there's a need, people step up and help that. And I hope that I know we'll continue to be that. But the struggle is real right now. People are facing some tough times. And it's not, I also want to make sure people realize it's not who we typically think. We have a lot of working parents that are coming through our doors needing help and needing some support and just in a really tough situation. So yeah.
And you also do have on the website and on social too, where you'll have events sometimes where like parenting classes even, or childcare, different groups, like if they watch and it's for them, they can go on these different events too that you guys have, right, too?
Well, so that's through Coddington Connects. We'll advertise and support all of the different things. Beacon Center leads the parenting classes, and so there's some of those kinds of things. Again, like, we have so many great resources and so many great supports in our community, and we try to keep it all on Coddington Connects. One of our staff people, that's one of the main things she does is keep Coddington Connects updated, tries to keep all the events on there, and so that if there are parenting classes or activities, Brothers and Sisters Behind Bars is doing a ton of different activities for community members, and so those are all on our calendar along with all of the other Salvation Army programs and different things that are out there. They're all on Coddington Connects.
Neighbors. All right. So just go to the website, follow you guys on Facebook. Those are probably the two best things to do.
Yes.
And any support they can give, find that online as well. So Sara Foust, Codington County Community Services Director.
Yes.
Yeah. Thank you for coming in. Yeah, I appreciate it. Thanks for everything you do for people. I mean, there's a lot of people that want to help, but you're taking the action to do it. So appreciate that.
Thanks. It's great things.
Yeah, you bet. Well, that'll do it here for Northeast Radio SD, and we thank Sara for coming in, and that's it. Such an awkward way to end.